My name is Kate Aronoff, and I have two kids. I have a 5-year-old son named Xander and a 2-year-old daughter named Eve. And we found out that our childcare center, where we sent our kids 4 days a week, was closing due to COVID. I think it was March 13th. We thought it was going to be closed for about 2 weeks at that time, and that seemed unimaginable. And then within about a week from that point, I think it was, or so, we heard that it was going to be closing permanently. And that was a really sad bit of news and also anxiety provoking because we didn't know what we were going to do. And we started calling around to all of the daycare centers in our small-ish town to see who might have space, and was able to get my children enrolled at another daycare. However, a couple of weeks later, we learned that that daycare was also closing permanently, which was another big blow. I do mental health counseling for individual adults, and during the shutdown, I was doing online sessions from home. And my husband works as a marketing manager for a university, and he has been working from home since the shutdown. The two of us were in different rooms of the house working. One of the rooms doesn't have a lock on the door, and so the kids can just bust in there anytime, and they have during important meetings. I had the kids come in there a couple of times during confidential sessions with clients, so that was really not a good setup. So working from home and watching our kids for our family was not going to be an option. We got creative and were able to get one of the teachers from Wonders, the original center that my kids went to come to our house and watch our kids part-time. So our school situation for the fall is still somewhat up in the air. They may be able to reopen under some very specific guidelines for hybrid, which is just going to be 2 days a week. And so my son is 5. He's going to be starting kindergarten. So we have him signed up for the hybrid option if it's available. If not, then he would be doing all online 5 days a week. And so we will need somebody to watch him, supervise him doing that online schooling, because he's too young at this point to be able to just do it all on his own. My daughter is 2, and she's still on the wait list for various childcare centers to start in September. I did contact them this week, and all but one said, sorry, we can't take her. We don't have space. I feel like my kids are missing out on a fair amount by not being enrolled in some kind of early childhood education program. At their previous school, they were getting great exposure to academics. They were learning their letters, their numbers. My son was learning how to read. They're also missing out on the socialization piece by not getting to go to school, not getting to see their friends, not getting to learn those social interactions that are so important to learn at this young age. As a mother and a mental health professional, I do worry about what this time in our lives is going to do to our children long term, what kind of effects that might have. It really is a trauma, and I think that will rewire their brains in some way. We live in Corvallis, Oregon. The population's around 55,000. It's a college town, fairly small. And so I know of, I want to say 4 childcare centers that have closed permanently. Corvallis was already hurting for childcare. We already had wait lists. My kids have been on the wait list for one childcare center since we moved here 4 years ago, and we still have not gotten in. From where I sit as a parent, I feel like the solution to the childcare crisis has to come from our government. It has to come from funding from our government. State, federal, both, I believe, need to step up and help save the crumbling childcare industry, because it is vital to our economy. You know, there's countless studies that prove the importance of preschool in success, future success. And I just think that government needs to step up and play a much bigger role than they have been in providing this very vital service to our families.
Childcare is essential for many American families to be able to return to work. But 30 to 50% of childcare providers in the United States have closed their facilities, and many may not reopen. Necessary enhanced health and safety measures due to COVID-19 could also lead to providers serving fewer children, which may impact how much childcare is available to families. An overwhelming majority of Americans support providing targeted federal financial assistance to childcare. Congress must act to ensure that childcare has the robust, dedicated relief it needs. Visit childcareaware.org to learn more about how to advocate for childcare. It's as simple as this: no childcare, no recovery.